Have you ever wondered why some neighborhoods have an abundance of grocery stores while others have none? Why in some communities fresh fruits and vegetables are within walking distance, while in others the only option is a gas station snack aisle? This isn't just bad luck or coincidence, it's a systemic issue and it has a name: food deserts. In the United States, nearly 19 million people live in areas where access to affordable, nutritious food is severely limited. The U.S. Department of Agriculture defines food deserts as low-income areas where a significant number of residents live more than a mile from a supermarket in urban areas or more than 10 miles in rural areas. And for millions of Americans, that distance makes all the difference. Take Jefferson County, Mississippi, one of the most food-insecure counties in the country. The median household income here is just over $20,000, and about 1 in 3 residents struggles with food insecurity. There are no full-service grocery stores nearby, leaving residents with few options beyond fast food and corner stores filled with processed, unhealthy foods. As a result, life expectancy in Jefferson County is 5 years lower than the national average. In urban settings, the problem isn't much better. In Bayview Hunters Point, a historically black neighborhood in San Francisco, there were no chain supermarkets for decades. Residents had to travel long distances just to buy fresh produce. Instead, many relied on convenience stores and liquor shops that stocked mostly packaged, high-calorie, low-nutrition foods. The result? Increased rates of obesity, diabetes, and heart disease, all rooted in food inequality. Living in a food desert isn't just inconvenient, it's a public health crisis. Without access to fresh food, people are forced into diets that lead to higher rates of obesity, heart disease, and diabetes. In Jefferson County, for example, nearly half the adult population is obese, and men die from heart disease at a rate 20% higher than the national average. Food deserts don't just make people hungry, they make people sick. But this isn't just about availability, it's about affordability too. Even when grocery stores exist in low-income neighborhoods, prices are often higher. Milk can cost up to 5% more, and cereal up to 25% more than in wealthier areas. And when wages are low and expenses are high, families often have to make impossible choices between paying rent, keeping the lights on, or buying healthy food. So what's being done about it? Communities across the country are stepping up with innovative solutions. In Jacksonville, Illinois, local activists have turned empty lots into thriving community gardens, providing fresh fruits and vegetables to neighborhoods that lacked access. In Atlanta, urban farms are revitalizing lost green spaces, bringing produce straight to the people who need it most. And in Los Angeles, support programs like Supermarket have created affordable, organic grocery stores in historically underserved communities, proving that change is possible. Food deserts are not just a food problem, they're a health problem, an economic problem, and a social justice issue. If we want to achieve health equity, we need to ensure that everyone, no matter where they live, has access to the nutritious food they need to thrive. At Voices of Equity, our mission is to educate, inspire, and empower communities and future healthcare leaders to tackle systemic health disparities. Food insecurity is just one of many challenges we work to address alongside access to healthcare, education, and economic stability. Want to learn more? Visit us at thevoicesof.org and join the movement to create lasting change in communities across the country.